Democrats against the Republicans, even actually pitting some Democrats against Democrats. The Dems promising, though, to reform the healthcare industry while the GOP is vowing to stop them in their tracks. So could this be the wedge that drives both parties further apart, putting an end to any hope of bipartisanship down the road? Joining me now for a fair and balanced debate, Congressman Timothy Murphy, a Republican from Pennsylvania on the Subcommittee for Health, and Congressman Engel, a Democrat from New York, and on the Energy and Commerce Committee, also on the Subcommittee for Health. Gentlemen, thank you very much for coming in on a very messy weekend. Sure. Right now, the count is still 5 votes short of what is needed for passage, 211 for, 220 against. But despite that, I don't know if you saw Chris Wallace on Fox News Sunday this morning, but he had Democratic Congressman Chris Van Hollen on this morning, and he said that he feels that the people, not the elected officials, but the people will actually get those still opposed or dragging their feet to go in. I want you both to listen to this.
Well, the votes will be there because what's happening is our members are going back home to their constituents who are opening up their mail and getting these huge increases in their insurance premiums. And they recognize that doing nothing is not an option. Small businesses recognize that. Big businesses recognize that. So the momentum has been clearly built. And when this vote comes, I'm confident there will be a majority.
Congressman Murphy, confident that there will be a majority. Do you think he's being realistic? Are the Democrats realistic?
Well, I think the realistic thing we ought to be paying attention to is not the votes on Capitol Hill, but the votes across the nation. I've sent out throughout my district about 700,000 pieces of mail and emails. I've received tens of thousands of mail pieces back and emails. I've had 225 meetings and town hall meetings. My staff has met a couple hundred times. And my district, which is majority Democrat, is opposed to this by over 2-to-1 margins. People are deeply concerned that with all the number games in this, it still will increase by borrowing from this phony long-term care fund, $500 billion almost from Medicare. We're talking about $600 billion of other debts we're going to have to incur here. And they're very concerned, too, that the president's campaign promises about we're going to attack Hillary Clinton for wanting to mandate health insurance, that you had to carry it, or John McCain for taxing insurance plans, that these promises are broken. And America says we want health care fixed, and they want Democrats and Republicans to sit down and do it, but they don't want this version.
Okay, Congressman Engel, Nancy Pelosi claims that Democrats are in their home states this weekend, and they're listening to their constituents, and they will turn things around. And we all know Nancy Pelosi, she can get votes when she tries to get them. But there are Democrats that still remain against this bill after all this time. I'm trying to figure out exactly how this weekend is going to make any difference in convincing even Democrats who disagree with this bill.
Well, this is obviously a major bill, and I think the Democrats, we understand that there's a need for health care reform. Not all people may like exactly what's in the bill, but Democrats want health care reform. Right now, too many people are being denied coverage because they have a so-called pre-existing condition. If someone loses their job or changes their job, they lose their insurance. Insurance companies are imposing annual caps or lifetime caps beyond which they say they will not insure people. There are people who have paid their premiums year in and year out. When they get sick, they're told, sorry, you're not covered. I mean, that has to stop, and that's what we have to do. Now I'm sorry that it's gotten down to this, but just said no to everything right down the line. Some of my Republican colleagues have said, well, why don't you go slower? Why don't you take it incrementally? Why don't you do that kind of reform? I would say respectfully, Republicans were in control for 6 years, had both houses of Congress and the president. They never touched health care reform. They were satisfied with the system the way it is. We're not. Now, you can pick apart a bill. You can say a whole bunch of things. It is controversial because there have been so many misperceptions and downright mistruths about the bill that I'm surprised that as many people say they're for it or for it. We think that this bill is what America needs. And again, I haven't committed to absolutely vote for it because the devil is in the details. I want to see the language, and then I'll make my... We need health care. We can't put our heads in the sand anymore. We need reform for health care.
Okay.
And no one's saying we should put our hands in the sand. We're all saying we need health care reform. I've been, as a co-chair of the Doctors Caucus, I know we need health care reform. Costs are out of control. But just saying the issues with the insurance companies, I agree we have problems with insurance.
Hold on a second.
Let's fix those things.
The question is, how are the Democrats, what measures are the Democrats going to take in order to get their health care reform. Congressman Murphy, you say that Pelosi will get her votes by promises of taxpayer money being used to buy votes behind the scenes. You say if it was such a good product, why was over $1 billion just spent on buying Senate votes? Those are your words, not mine. And here's my one Republican this morning accused Speaker Pelosi of potentially thinking about bending the rules and making it so that there's not a direct vote on the Senate health care bill. Is that something that Nancy Pelosi indeed potentially could be pondering? Congressman Engel.
Well, look, there have been a lot of people complaining about that this bill is going to go through a process called reconciliation in the Senate. Since 1981, Republican presidents have signed 14 of the 19 reconciliation bills. Reconciliation was done under Republican Congresses for welfare reform and for the Bush tax cuts. These are things that are done over time, and to pretend that somehow arms are being twisted and this was never done. I mean, I remember Denny Hastert twisting Republican arms when they kept the bill open till 5 in the morning on Medicare Part D, which was a huge entitlement that blew the deficit out of control, done by Republicans with arm twisting. So this sort of pious attitude that we don't twist arms and only the Democrats do, that's the way it works in Washington.
All right, Congressman Murphy, I'm going to give you the last word because I want to be fair here, but we have to go.
If it's really a good idea, you shouldn't have to bully members, bribe them for votes, or bend the rules. I am absolutely committed, as are my colleagues, to working on health care. Let's fix this, but America is saying this is not the version, and let's hope that we can still come to some conclusions that work and not just have a $1 trillion plan here that's going to really hurt the American people.
All right, Congressman Murphy, Congressman Engel, thank you very, very much for talking to us.
Thank you.
Greg.
Rising floodwaters in central Iowa.